Those who suffer from panic attacks always endeavor to maximize the availability of air. And when they have a panic attack and they leave the situation which they're in, what are they doing? They're in fact racing for air, where in fact really it's quite an irrational response, because the air in the room they're leaving is not that much different from the air which is outside. One interesting study which has emerged recently was that people with panic disorder often have a history of respiratory problems in childhood. And it has been shown that those people who have children or adolescents who have asthma, significant doses of bronchitis and pneumonia will often go on to develop panic disorder. And I think to emphasize the suffering of those people with panic disorder, I'm most sympathetic with this group of people, is that those who experience panic attacks exhibit greater anxiety in unpredictable circumstances. They worry more, and that worry generates the panic. Now, panic attacks can be divided into various kinds. They can have situations, that is, they're fearful of going, say, into a supermarket for fear of having a panic attack. If they go into a supermarket, they'll always know where the exits are. If they go to a movie theater, they'll sit at the back, sit on the side, ready to get out. Those who have spontaneous panic attacks, these are the most serious of people. They will have their panic attacks anywhere at any time. Limited symptom attacks are those who have just one or two symptoms, but those one or two symptoms still make the circumstance for them stressful. Now, the two sorts of panic attacks I'm most interested in is nocturnal ones. These occur when a person is going off to sleep, or they may wake in a state of panic during sleep. Now, nocturnal panic attacks are in fact the worst type of panic attack for people to have. They can last for about 30-odd minutes, and their symptoms are indeed much more intense. The final one is relaxation-induced panic attacks. Sounds strange, because everybody's taught relaxation therapy, except myself, in terms of panic attacks. This is what happens. People with panic disorder are always very sensitive about their body, how it is functioning. If they notice any odd changes going on, they will often misinterpret those changes and become distressed by those changes. And that distress can lead on to panic. And hence, I'm not that much in favor of teaching people with panic disorder relaxation therapy. I think it is counterproductive. As I said, nocturnal panic attacks, they have more panic symptoms. They have greater somatic symptoms, greater aches and pains throughout their body and other symptoms. More likely to develop agoraphobia, that's avoiding going into situations for fear of having a panic attack. Have a higher incidence of depression or mood disorders, report more respiratory problems, and greater incidence of actually having also major sleep disturbance. People with nocturnal panic, we need to take very seriously in treating them. But they are frequently not asked about. Panic disorders where they keep on having panic attacks. At least one of the attacks is followed by one or more months of the following: persistent worry and concern. Once a person has had a panic attack, what happens? They go on worrying and concerned about the next attack. Correct? It's never out of your mind, is it? You fear it so much because they really do think they're going to die or in fact go crazy. But in fact they don't. And these cognitive symptoms of panic are quite amazingly important for the individual. And I had a lady and lady and husband came in to see me a couple of years ago now, and this lady, her biggest fear was that if she had a panic attack, she would in fact die. And I said to the couple that, you would make me famous if you died having a panic attack, because people don't die when they have panic attacks. And the husband said, it might make you famous, but it would actually annoy me a great deal if my wife died in a panic attack. People go on worrying about the implications of the attack, and significant changes generally relates to the attack. They start developing agoraphobia. They can do that after the first attack, or they start worrying more, they start visiting doctors more, and so on. Now, 55% of those with panic disorder actually meet the criteria of an anxiety disorder. Now, anxiety disorders in children don't always go away. Some do, others will go on to develop other symptoms. This is why I think as a community we should be spending a lot of our resources on treating childhood anxiety problems to prevent their progression. And we're able to treat these children quite successfully because the brain is so malleable, we can help rewire that brain in childhood much more successfully. 50% of relatives of those with panic attacks also have an illness or an anxiety disorder. Hey, it's genetic. Twins, identical or fraternal, it's much more common amongst, if it's identical twins have got it, there's a 45 to 65% chance that the other twin will have it as well. And fraternal, there's about, I think it's about 25% concordance rate. And for some people, you don't even need a family history. Sometimes medical conditions or the stresses and strains of a person's life can lead them on to develop panic attacks. Now, panic disorder with agoraphobia, this is when not everybody who has panic attacks will develop agoraphobia, but a significant percentage will do. And what they like to do is always be in a situation where they can feel safe. And they'll all, in the other side of the equation there, is they'll always have a degree of avoidance of being in situations unless they are with a trusted other. And that could be a relative or a friend. I could take a person perhaps with agoraphobia who knew me to Chadstone and walk around Chadstone or Southdown, but ask them to do it alone, they possibly couldn't. And that significant other is particularly important. Those who have panic disorder, comorbidity is the norm. That is, the existence of another illness. And the most common one is 90% of them go on to develop major depression. And it's been shown in some studies that within 1 year of a person having their first panic attack, something like 60% of people will go on to develop major depression. And I would argue that's because of the stress which arises from people having that panic attack. 42% will attempt suicide. It's an amazing figure. 40% have specific phobias. 30% have social anxiety disorder, and there's a very high abuse rate for alcohol and also illicit drugs. And why are they using the alcohol? Why are they using the illicit drugs? It's indeed being an effort for them to control their symptoms and to give them a sense of tranquility and peacefulness. Panic disorder is chronic for most, and that's pretty tragic. 20% of actually get a remission, 15% relapse, and up to 50% of people continue to have persistent symptoms of panic throughout most of their life. For many people with panic disorder, it's a chronic illness, and they often need medication or other therapies for a significant period of time. Occurs across the lifespan. 10% of children, adolescent and adulthood, a significant percentage will go on to develop panic disorder. In fact, it's between the ages of 18 and 35 that most panic actually occurs. And over the age of 60, 50% will experience panic attacks for the first time. As I said, this is a group of people we're now beginning to take more notice of. They do indeed develop anxiety, often for the first time, and I think they're often not taken seriously enough. They have a high rate, people with panic disorder have a high rate of healthcare utilization. And I think the use of medical and psychiatric professionals, more people use that than any other psychiatric diagnosis, and those people with no psychiatric diagnosis. You can see financial dependency of these people. These are people who get on welfare benefits. Hospitalization for physical problems is high, and visits to the emergency department are also very high. The mistake being made that something more severe than or more like a heart attack is occurring than in fact is.